Hi there, today we'll be learning about ORT4CLA test. This test is an assessment of binocular functions, including simultaneous perception, sensory fusion, and suppression. It involves 4 circular lights, 2 green, 1 red, and 1 white. These lights are viewed through red-green goggles worn by the patient. The red circular light is seen through the red filter of the goggle, usually the right eye, whilst the green circular light is seen through the green filter. The white light is common to both eyes. This test must be performed in the dark and it can be done at either 6 meters or 1/3 of a meter. The equipment required in order to perform the ORT4CLA test are red-green goggles, a ORT4CLA torch to test at near, and a screen with the 4 dots situated at 6 meters to test at a distance. Indications for use. So basically the when and why. The ORT4CLA test is usually used to assess the patient's capability of binocular fusion by determining whether an individual simultaneously aligns and fuses 2 images together using both of their eyes. It is also used to detect binocular single vision by testing for suppression, diplopia, or the ability to see the 4 dots. This is to confirm or support the analysis of a patient's eye condition of either normal retinal correspondence or abnormal retinal correspondence that is featured with binocular single vision with bifoveal fixation, the type of strabismus, amblyopia, the degree of deviation in the eye, for example, microtropic deviation, central scotomas, and peripheral limitations. It may be adopted to indicate the patient's potential to employ binocular vision in future by determining the adaptation levels of sensory and fusional abilities. It can also guide the clinician's choice of management, including possible strength of prism or occlusion use for critical periods in children with amblyopic eyes that is used upon diagnosis of misalignment in the visual axis. Whilst performing, the test could initiate the patient's dominant and fixing eye after comparing the test results to the individual's visual acuity of either eye. Now for some really important points for when you're performing the ORT4CLA test. Make sure you introduce yourself to the patient and then confirm their name, address, and date of birth just to make sure you've got the right person. It is very important that you explain the test and how it is performed to the patient in the most simplest of terms. Make sure that you use hand hygiene by sanitizing every piece of equipment before you touch them. Use alcohol wipes on things such as goggles before handing them to the patient. Make sure the lights are dimmed in order to get the most accurate results. Let's see how it would be done in clinic.
Sahithya, Ravi Children. Yep. If you could please come in. Yep. Hello, my name is Zakera and I'm going to be your optometrist today, and we're going to do the ORT4CLA test. So if you could please confirm your name, date of birth and address.
Yep, my name is Sahithya. My date of birth is 22nd of March 2001 and my address is 5 Miller Street, Bandura.
Okay, thank you. So the ORT4CLA test involves how well your eyes work together. So just before we start the test, do you wear any glasses?
No.
Okay, so I'll be giving you these red and green goggles for you to wear, and then I'll flash this torch in front of your eyes and you'll see circles, and then if you could tell me the number of circles you see and what color are they. So I'm just going to sanitize my hands. So if you could pop on these glasses please for me. So is that comfortable?
Yes.
Yeah. So now for this test we're going to dim the lights. So now I'm going to flash this torch in front of your eyes. So if you could tell me how many circles you see and what colors they are.
I see 4 circles.
And what positions are the circles?
The red one is at the top and there's there's 2 green on the side and there's a white at the bottom.
Okay, thank you. Just to confirm the test results, I would like you to draw what you saw.
This is how the patient's results would be recorded. Alrighty, now let's look at how we would interpret these results. If a patient sees 4 circles, 1 red, 2 green and 1 white, it can mean that the patient has normal BSV, NRC, with no strabismus. If the patient has a manifest strabismus and they see 4 lights, this means that they have a sensory adaptation. Now, if the patient sees 5 circles, this means that the patient is experiencing diplopia or double vision. The type of double vision can be determined by asking on what side are the red circles and the green circles, and are the circles side by side, or is one set of circles higher than the other? And do you notice all 5 circles at the same time? If the red circles are on the left, this means they have cross diplopia. If the red circles are on the right, this means they have uncrossed diplopia. And if the red circles are higher than the green circles, this means they have a left over right deviation. If a patient has alternating strabismus, they can have alternating suppression, where they might only see 2 red circles for a moment, and then they'll see 3 green circles. On the other hand, if they only see 2 red circles, or only see 3 green circles, this could mean that one of the eyes are suppressing. So 2 red circles could mean that the left eye is suppressing, while 3 green circles could mean the right eye is suppressing. Just like every other test, the Works for Light test also has its advantages and disadvantages. The advantages include it being quick and simple to perform on all types of patients, including elderly and the children. It is also non-invasive and easily administered. It can be used to determine if a patient will demonstrate BSV with a corrective prism or an abnormal head posture. It's also easy to record and easy to interpret the results. On the other hand, the disadvantages include it being subjective. It cannot be accurately performed on patients with red and green blindness. It's also highly dissociative and limited to measure depth of perception of the stereo acuity levels, and the lights will need to be turned off or dimmed, which could scare some patients. Lastly, here are some tips on how to get the most accurate results out of your patients. The reliability of the Works for Light test can be impacted from repetitive measures due to which patients, especially children, may memorize the results from the last test and therefore provide inaccurate results. It is important to give instructions correctly and ask questions clearly to receive an answer that aligns with the diagnosis. It is also best to avoid using the test more than twice and alternatively use other tests that assess binocular vision like Baggallini-Striate glasses. Furthermore, the clinician may unintentionally give away hints on how many dots are on the torch by asking close-ended questions like, "Do you see 4 lights in front of you?" The patient may likely answer yes by thinking there is a right and wrong answer. Therefore, to prevent this matter, it is better to ask questions where the individual can answer more openly, like how many dots do you see and what colours are there. Overall, it is not recommended to use a Works for Light test as the only device to evaluate and confirm a patient's diagnosis. It is important to be aware that the Works for Light test is a supporting tool to further confirm the ocular condition that is used in a combination with other ophthalmic vision tests, such as the Baggallini-Striated glasses, cover test, stereo acuity, and prism cover test. If you made it to the end of this video, you're now an expert on the Works for Light test. Congratulations. Bye now.